everything in English. Buenos días, tardes o noches, dependiendo de dónde nos escuchan. La sesión va a ser tanto en inglés como en español, entonces necesitamos que seleccionen el canal de idioma de su preferencia. En el Zoom, en el menú inferior, hay un globo que dice interpretación o hay una sección de un círculo con tres puntos que ahí podrán acceder. Deben seleccionar el canal de español para poder escuchar todo en español y también si en algún momento quieren hacer alguna intervención, entonces podrán hablar en español sin ningún problema. Retorno un segundo a inglés. So, as new people enter in the Zoom, the session will be both in Spanish and English, so please select your desired language in the Zoom menu. There's a globe that says interpretation. You can click there and then select English or Spanish as you prefer. Una última vez, porque ingresó nueva gente, tenemos el panel tanto en español como en inglés. Entonces, por favor, en el menú inferior de Zoom hay un mapa mundi que dice interpretación. Ahí podrán seleccionar entre inglés o español. Vamos a iniciar en un minuto. So we're about to start like in a minute. Ok, entonces voy a ir brindando las instrucciones. Muy buenos días a todos y todas. Bienvenidos a este segundo
Good
webinar de
morning,
economía
everyone. Welcome to
del
the second
consumidor.
webinar
Tenemos
of
algunas
the
instrucciones
Economy of
generales.
Care. We have
Primero que
some
todo,
general housekeeping
agradecerles por
announcements.
mantener su micrófono
First of all,
silenciado
we
para
would like
evitar
you to,
que
and
nos
thank you, if
distraigamos
you
con
please keep
ruidos.
your microphones
Asimismo, como
muted
les mencionaba,
until it
tenemos
is your
interpretación
time to
inglés-español,
speak.
así que por favor
We
seleccionen su
have
idioma de
interpretation
preferencia en
in
el
both
menú de Zoom.
English and Spanish
Cualquier pregunta que
available
tengan
that
la
you
pueden
can
compartir
select
en la
below
sección
in the
del
Zoom
chat de Zoom.
menu. Any question you
Asimismo,
have, you
tendremos una
can
sesión de
either type
preguntas y
it in the
respuestas al
chat
finalizar,
section
entonces
of the
podrá
Zoom
a través de
or
la aplicación
raise
del
your
Zoom
hand through
levantar
the
la mano
React
y le iremos dando
icon
la palabra.
so that
Asimismo,
you
la sesión de
can
hoy ya está
ask it
siendo grabada, así
verbally.
que por
Today's
favor, si
session
no
is being
desea que se le
recorded,
grabe,
so if
puede
you
apagar
do
la cámara.
not like to be recorded, you can mute your camera as well or turn it off.
Entonces, bueno, voy a introducirme rápidamente. Mi nombre es Carlos González, soy el
My name
coordinador
is
de
Carlos
proyectos
González.
de
I am
Cooperativa de
the
las Américas. Me
project
acompaña también
coordinator
mi colega
for the
Annalisa Balón,
Cooperative of the
también
Americas, accompanied by
coordinadora
my
de
colleague
proyectos
Annalisa Balón,
de la Oficina de Cooperativas
project
de Europa.
coordinator
Entre los dos
from
vamos a
the
ser sus
European
moderadores el
chapter.
día
We're
de hoy.
both going to be your
Así que,
moderators
como
for
ya saben,
today.
este webinar es la
As
segunda
you know,
parte
this
del primer
webinar is the
webinar que ya
second
tuvimos el
part
día
of
15
the
de
first
septiembre. Así
webinar
que le
that
voy a
we
ceder la
held
palabra
on
a Annalisa
September
para que
15th.
nos recuerde un
I'm
poco
going to
acerca de los
yield
principales
to
resultados
Annalisa so
económicos
that she
del
can
primer webinar.
report the
Adelante,
main
Annalisa.
outcomes of the first webinar.
Gracias,
Go ahead.
Carlos. Thank you. And good morning, good afternoon, everyone. Also, on behalf of Cooperatives Europe, it's a pleasure to host you for this second Euro-American dialogue, where we put a lot of efforts and ideas to try as much as possible to map and document the cooperative approach to the care economy. So very briefly from my side, here are some key messages that we gathered from our previous webinar, who saw a very multi-stakeholder discussion, starting from key institutions like the UN, where we had representatives from the International Labour Organization and UN Women, up until the European Union, who is a key donor in international development and also currently funding the COPS for Dev program that links the work in Europe with the work in the Americas, and that made also this webinar possible. We also had the opportunity to have guests from among our cooperative members, especially from our sectors, SECOP and SICOPA. It's a pleasure, Christian, to see you once again today with us. but also from academia and researchers working in the sector to analyze challenges and opportunities. There were many common conclusions for good and for bad, one of which being that there are two rising trends also still impacting on the sector. One is that of informality. As we know, a lot of the care work is unfortunately unpaid, unrecognized, always stays invisible because it happens in a private space. So it's a lot of time that especially women dedicate to work, but sometimes go just unnoticed because it's taken as a given, as normal. But that also leads to time poverty and limited access to education. So that would be the first. And the second one is privatization. So a lot of actors talked about how care is, despite being an essential service and also a human right, is increasingly being made profit upon, to the unfortunately to the exclusion of the most vulnerable of our societies, from the elderly to people with disabilities. But also again from a women from the care providers perspective as well, which leads to the second point of a motto, a key message which was shared, which was care for those who care. So care economy is not just a question of beneficiary, it's not just a service to receive, but also a service to give. And oftentimes the care providers are not only formal workers or personal assistants, but are also the family members themselves. Something that we reflect upon a lot on the importance of the cooperative model and how it differentiates from other models, just because, especially in the care sector, we saw from the best practices shared across the region that the care cooperative tend to assume a multi-stakeholder governance in a way that the care work is owned and shaped by the family members, the beneficiaries, but also the providers in a democratic way. And finally, when discussing between policymakers, but also donors, there was a common agreement of the importance of mainstreaming care, not only in the policy design, which is why a state must be present throughout the whole process. And the cases of the UK and Colombia were very key in that, because the UK government, for example, has committed to double the size of the cooperative care sector, especially while in Colombia we heard from our beautiful guests from a local town exactly discussing how they managed to advocate in 2022 for a specific law, a specific impact on Colombia. But also it's important to mainstream in investment opportunities. And in this case, it was very relevant, the intervention shared by the European Union in the context of Global Gateway, which is the EU development policy ongoing, which is investing in the care sector, not as a market opportunity as such, but really to invest into human development. And they themselves recognize the importance of small private actors like cooperatives in achieving that. So very interesting, but just to have a bit of a scene setter to also see why we're here today, which is to zoom in further into these best practices, to have our examples from across Latin America and Europe, also touching upon the legal framework, the enabling environment, why it matters, but also to focus on the diversity and inclusion angle, which is very relevant in the care sector, often overlooked, and how other sectors interplay with care, most notably housing. So I get back to Carlos for the moderation of the first discussions. Thank you.
Muchas gracias, Analisa, y muchas gracias, Andrea, por colaborarnos con la
Thank you,
interpretación.
Annalisa,
Pues bueno,
and
luego
thank you for
ese
the
increíble resumen
interpretation.
que nos ha hecho Analisa del
After
proceso
this
gobernante
incredible
cooperativista para este proceso,
summary
nos
of
gusta
the
contar
first webinar
con cuatro
by
excelentes casos
Annalisa,
de
we have
estudio para este
the
nuevo
pleasure
webinar en el cual
of
estaremos
having four
discutiendo y
excellent
analizando
study cases
la
for this
relación que
new
existe
webinar,
entre
studying,
las
discussing, and
cooperativas del
analyzing
cuidado,
the
del cuidado
relationship
y el
between
acceso a la vivienda a
the
través de
care
las cooperativas
cooperatives,
de vivienda.
the
Entonces,
care
para
economy,
esta
and
primera sesión
housing
del webinar
access
contaremos
through
con
the
la participación de
housing
Damaris Luis y de
cooperatives.
Emilio Emolo.
So for the first
Así
section of
que
the webinar,
en
we
un
will
primer
have
espacio le
Damaris
daré
Ruiz
la
and
palabra a
Emilio
Maris
Emmolo.
Ruiz, quien es la directora de las
For the
oficinas de
first
Centroamérica
space,
de
I
We
will
Effect.
yield to Maris
Así
Ruiz,
que,
the
Damaris,
director of the
el espacio
Central
es tuyo
American
por
We
los
Effect
siguientes
Office.
aproximadamente
Damaris,
12 minutos para
you
que
have the
termines de
next
mantenerte
12
dentro
minutes
de ese
to
espacio.
try to fit to the
Si podrás
agenda.
compartir pantalla, Damaris, adelante.
You can share your screen whenever you're ready.
Bueno, primeramente, muy buenos días,
First of all,
buenas
good
tardes a
morning,
todas y
good
todos.
afternoon, and good evening
Es
to all.
realmente un
It is a
enorme
true
gusto poder estar en
source,
este segundo
a
webinar,
pleasure to be
en
present at the
donde vamos a
second
compartir
webinar where
las
we will be
experiencias que hemos
sharing the
venido
experiences.
acompañando hoy. ¿Sí?
Un segundo. ¿Puedes
I'm
ir
sorry,
al menú de
Damaris.
interpretación? Porque creo que estás en audio
Can you
original, entonces no te
move
escuchamos en canal
into
español.
the interpretation
Ujú.
menu because you're in the original audio menu?
Muy bien. Escojo Spanish.
Ajá.
Got it.
Ok. Y vuelves a compartir.
Great. Ahí pueden ver, ¿verdad?
Perfecto.
Muy bien.
Perfect. Here
Bueno,
we
pues
go.
les decía que es un gran
As I
placer
was saying,
poder compartir
it
este
is a
espacio con
pleasure to
todas
be
y
able
todos
to share
ustedes.
this space with
Y
all
va a
of
ser pues
you.
un momento en el
And
que
it's going to
quisiera
be a
contarles
moment
cómo hemos venido
where
trabajando
I
en
will have the
cuidados
pleasure
y
to tell
viviendas
you
de la
how we've
perspectiva
been
cooperativista en
working on
Centroamérica,
care
pero por
and
supuesto
housing
también les
from the
quiero
Central
compartir cómo
American
estamos avanzando
cooperative
a nivel global como
perspective
WIFE.
also,
Como sabrán,
sharing how
WIFE es una
we are
organización sueca fundada por el
working
movimiento cooperativo de
globally.
Suecia.
We
Así que
affect.
nuestro
We
compromiso
affect
profundo
is
para
a
que
Sweden
podamos avanzar en la agenda que acompañamos desde
founded
la perspectiva
cooperative
cooperativista. Pero
movement
antes de empezar
with a deep
sobre este tema en
commitment to
particular, yo sí
advance on
quisiera
the
hoy
cooperative
recordar
perspective. I would
que
like to
para
remind
todas
you
y todos
today,
es un día
though,
muy
that
especial. Hoy
for
es el
all of
Día
us,
Internacional
today
por el
is the
Derecho a la
International
Alimentación
Day
y
for the
ayer fue
right
el Día Internacional de las Mujeres
of
Rurales.
food
Como
or
saben, todavía
feeding
muchísimas
people. And
personas, sobre
also,
todo
it was
mujeres, niñas
International
y
Day
niños,
for
siguen
rural women.
sufriendo
As you
desnutrición
know,
y
many
todavía
individuals, especially
tristemente tenemos a
women
muchísimas
and
niñas y
girls
niños y
and
mujeres
boys, are still
muriendo por
suffering
esta
from
causa en el mundo,
malnutrition.
lo cual
We
es
sadly still have
absolutamente
many
injusto.
children
Las
dying
mujeres rurales siguen siendo las
malnutrition around
principales
the world,
productoras de los
which is
alimentos que
unjust.
consumimos.
Rural women
Y a pesar
continue
de
to be
que
the
7
main
de cada
growers
10
of the
mujeres
food
que
we
cultivan
eat.
la
And
tierra,
in spite of the
apenas
fact that
solamente
7
3
out
de
of
cada
every
10
10
tienen el
women
título de
cultivate the
esas
land,
tierras. Entonces,
only
yo solo
3
quería
out of
hacer este
every 10
recordatorio
are
para que
titled
también nos
holders
podamos
or
tener
have
presentes pues, en estas reflexiones que
own
vamos a
their own
compartir
land. I
el
would
día de
like
hoy.
you to have this
Pues
present,
miren, en
the
nuestra
reflections we're
región
about to share
latinoamericana, el
today.
derecho al cuidado y el
So our
derecho a
Latin
la vivienda,
American
pues
region
son
has a
todavía
right
temas
to care and
urgentes
route to
que representan
housing
también a
still
su vez
pending
enormes
as
desafíos.
urgent
Como decía
topics
Annalisa,
that
millones
represent
de mujeres
incredible challenges.
todavía
As
son las únicas responsables de
Annalisa
este
was saying,
trabajo
still
que es
millions of women
absolutamente
are still
importante
the
para
only
sostener la vida, pero que sigue
responsible or
siendo muy
accountable for this
invisibilizado.
work.
Y por supuesto, esto está
It
totalmente
is
conectado con las
incredibly
muchísimas
crucial
familias
for
en nuestra
their
región y
lives and is still
alrededor
too
del mundo,
invisible
pues
for
siguen
everyone
viviendo
else. And this
en
is fully
espacios que no
connected or
reúnen ni
linked
siquiera las
with what
condiciones
many families in
mínimas.
our regions and
Pues muy
around the
bien, el
world
día
still
de hoy
live
les
in
quiero decir que
spaces
para
that don't
WIFE
even have
el
the
derecho al
minimum
cuidado y el
conditions
derecho a
to
la vivienda no
provide
son
that
dos
care.
aspectos separados, los
Today,
vemos
I would like to say
profundamente
that the
conectados
right for care
porque
and right
ambos
for
están
housing are not
directamente
separate
relacionados con
aspects.
la
They're deeply
posibilidad de
connected
sostener
since both
la
are
vida,
directly
la
related with the
dignidad, pero
possibility
también la
of
comunidad.
sustaining life, dignity, and community as well.
Y por supuesto, ¿verdad? Aquí es importante decir que a nivel
I
global
can tell
vivimos
you
una crisis
that globally
doble,
we're
la
living
crisis sobre el
through a
cuidado, pero
dual
también la crisis
crisis,
sobre el acceso
both the
a la vivienda.
crisis on care
La vivienda y
providing
el
and
cuidado
also
no
access
deberían ser
to housing.
considerados como lujo.
Housing and
Pero
care should never be
actualmente y
considered as
desafortunadamente las
luxury.
personas que tienen acceso
Unfortunately
al
and
cuidado
currently,
y
those
acceso
that
a la
have
vivienda
access to
son las
care and
personas que
housing
generalmente pueden
are
pagarlo.
those that can
Y estos
generally
deberían
can
ser
afford
considerados
it.
como
This
derechos
should be
colectivos
considered
y que se
as
sostienen a
collective
través de la
rights,
cooperación y de la
sustainable
solidaridad.
through cooperation and
También es importante
solidarity. It is
poder tener
also
en cuenta
important
que
to be
estas
able
dos crisis tienen
to be
profundamente
reminded
una
that these
mirada de
two
género, porque
crises
como les
have a
decía,
deep
las mujeres siguen
gender
siendo casi
look
las únicas
or outlook
que
because women
asumen
are
esta
the only
responsabilidad
ones
sin
that take on
reconocimiento
this
y sin ningún tipo
responsibility
de
without
protección.
any
Entonces,
recognition
ambas
or
crisis se
protection at
alimentan
all.
la una
Both
a la otra. Sin
crises feed
cuidados,
on each other
sin vivienda
without
segura, es
living
muy
or without
difícil que
safe
podamos avanzar
housing, it
en la
would be
agenda
very
de los
difficult for
cuidados.
us to
Y por
advance
supuesto,
in the
si no
agenda
podemos
of
avanzar en la
care
agenda de los
providing.
cuidados,
And if
las
we cannot
viviendas
advance in care
donde
providing
habitamos se
agendas,
vuelven
the
imposibles para
houses
que
we
sean
live
espacios
on
en donde
become
podamos
impossible
desarrollar
spaces,
nuestra vida
preventing the
como tal.
development of
Las
our
cooperativas han
life.
demostrado que la vida puede ser
Cooperatives have
organizada de
demonstrated
manera
that life
diferente,
can
o sea,
be
por las
organized
personas y
in a
para las
different
personas.
manner
Y por
by the
supuesto, a
people,
través de
for the
modelos que
people, and
puedan poner
especially
la justicia
through
social
models
por
that can
encima
place
de las
social
ganancias.
justice on top of profits
Quisiera
or
también
above them.
compartirles cuál es la
I
visión
also wanted to
transformadora,
share the
cooperativa y basada en la
transforming
comunidad que
cooperative
tenemos desde
vision,
WeEffect.
community
Para
base that
WeEffect
we have
entendemos que el
from
cuidado
We
es un derecho
Effect.
humano,
We
tal y
Effect
como fue
understands
reconocido
that care
recientemente.
providing is
Y
a
a la vez
human
es
right
una
as it
condición
was
tanto para la justicia
recently
de género
acknowledged.
como para
It's a
la justicia
condition that
económica.
entails
Y
in
por
gender
supuesto
justice
vemos
and
en la
economic
vivienda
justice
como una
equally.
plataforma para
We
que la
see
comunidad
housing
del
as a
cuidado pueda
platform so
avanzar y
that
para
the
que también
care
las responsabilidades
community
de los
can
cuidados
advance and
puedan ser
so that
compartidos.
the
Porque para
responsibility of
nosotras y
care could be
nosotros la
shared
vivienda
as
no es
well.
solamente
Because
un
for
techo
us,
o unas
housing
paredes,
is not
¿verdad? Se
just about a
convierten en un
ceiling or a
espacio
couple of
en donde
walls.
podemos
They
fortalecer
become the
las
space where
relaciones
we can
humanas, la
foster human
solidaridad, pero también
relationships,
la equidad y la
solidarity,
igualdad
as
de
well
género.
as equity
Y
and
estos dos
gender
aspectos,
equality.
cuidado y vivienda,
Both
entonces
aspects,
forman la base de lo que
care and
llamamos la
housing,
sociedad
form the
cooperativa del cuidado
foundation
en
of what
WeEffect
we
y que
call the
juntos y de manera
Cooperative Care
colectiva nos
Society
permiten
in We
sostener
Effect,
la
which
vida.
collectively allows us to
Quisiera
sustain
compartirles
life.
ahora tres
I
experiencias
wanted to share
concretas
with you three
a las que
concrete
hemos venido
experiences
acompañando
that
en los
we have
últimos 12
accompanied
o 15 años en WeEffect.
or
La primera
that
es
we have
la
cared for
CoCuidados,
side by
que se
side
ha
for the past
organizado
12
y
or
que se ha venido
15 years
empujando
in We
desde
Effect. The
Honduras.
first is
En la
COP.
CoCuidado están
A COP
organizadas las mujeres
Cuidados
trabajadoras
or COP
remuneradas de
Care
Honduras
has been
y ellas
organized
decidieron
and
que
fostered from
el modelo
Honduras.
de
They have
cooperativa
been
es la que les va
organized
a
in
permitir
working
poder
women
avanzar
in
en el
a
trabajo decente para que
salary-oriented
también así puedan ser reconocidas,
path.
¿verdad? En
This
el
cooperative
mercado de
model
trabajo formal,
in their
puedan
decision
gozar de
will
la
allow
seguridad
them to
social y que además de
advance
manera
because
colectiva
it
pues
provides
puedan luchar por sus
decent
derechos
work
básicos.
so that they
Como
can be
sabemos, las mujeres
acknowledged
trabajadoras
in
del
formal
hogar son
working
las que
markets
más
and models,
sufren las
enjoy
injusticias del
social
trabajo
security or insurance, medical
informal.
insurance, healthcare
La
insurance in a
segunda
collective
experiencia es
manner,
lo que hemos
allowing them to
observado
fight for
en los
their
centros de
basic
cuidados
rights.
comunitarios.
As we know, they're
Estos
the
centros de
ones that
cuidados
suffer from
comunitarios también
working or
están
occupational
basados en Honduras
injustice in the
y dos
highest
ejemplos de
degree. The
ello pues son
second
dos
experience
cooperativas
is
de
what we
vivienda,
call
la
the
Covizan
community
y la
care
Covimar.
centers. These
Estas dos
community
cooperativas
centers are
lo que han
based
hecho
in
es
Honduras. Two
integrar al
examples
modelo de
of them
vivienda
are
cooperativa
Covisana and
los
Covimar.
cuidados como un
They have
componente
integrated
fundamental.
to the
Entonces, como parte
cooperative
del modelo de
housing
vivienda,
model
existen centros de
care
cuidados para
providing
las
as a
mujeres.
fundamental
Y por
component.
supuesto,
As
esto ha
part of their
demostrado que
housing
además de que la
model, they
comunidad se organiza
include care
para,
centers
para
for
cuidar de
children,
manera adecuada a
demonstrating
las
that the
niñas y los
community can
niños,
be
las mujeres
organized
tienen la
and can
posibilidad de
organize
poder
themselves to care
soñar
appropriately for
con un trabajo
children
remunerado
and
decente para darle
allowing
un
women
nombre
to
a
have
sus
the
niñas y niños.
possibility of
Y
dreaming
la
with
tercera
a
experiencia
decent
es la encuesta
paying
de
job
medición de
because they
tiempos. Es
have
una experiencia
care
que
services
desarrollamos
for
en esta
their
región que
children.
se
The
llama el
third
Trifinio
is the
en
time
Centroamérica,
measuring survey. It's
básicamente
an
en Honduras
experience
y en
developed in a
Guatemala.
region
Y es
that's
algo
called
que hemos desarrollado
Trifinio
en el
in
marco del
Central
programa
America,
MEDID que
comprising
tiene
Honduras and
con
Guatemala.
mujeres en
Within the
Centroamérica y
framework
que ha
of
sido
the
a su vez
MEDID
una encuesta que ha
program
permitido
with
articular a
other
diversos
women's in
actores en
Central
diferentes
America
instituciones
has
nacionales y que
enabled a
actualmente
survey
está siendo
allowing different
considerada como un
actors to
ejemplo para ver
connect,
cómo las
including
respuestas
national
nacionales pues se puede
institutions,
incorporar
being
el
considered
componente
currently
de
as
los
an
cuidados.
example to
Pero
see
además de eso está
how
sirviendo como
national
herramienta para
surveys can
poder
be
incidir
incorporated
en
to
la
the care
necesidad de contar
component.
con un
It's
sistema
been used
nacional
also
de
as a
cuidados en
tool to
nuestros
have an
países de
incidence
Centroamérica.
in the need to
Así que
have a
bueno,
national
Cuidados es
care
parte de todo el
system in our
trabajo que
Central
desarrollamos
American
y por lo
cares.
tanto es parte
Cuidados is
fundamental del
therefore part
modelo
of
de
all the work
vivienda
we
en sí.
develop and therefore a fundamental
Bien,
part
entonces, ¿qué hemos
of the
aprendido de
housing
todo esto?
models.
Bueno,
Okay,
primero que las
what are the
cooperativas
lessons we have extracted
definitivamente
from all of this?
ofrecen
First of
una
all,
alternativa
cooperatives offer
incomparable para poder
an
avanzar en la agenda de los cuidados.
incomparable
Las cooperativas
alternative
en
to
sí mismo nos
advance in the
enseñan que
care
es
agenda.
posible vivir
Cooperatives
en
themselves
comunidad y que
teach
es
us that
posible
it's
que las tareas de
possible
los
to live in
cuidados también
community
sean
and that it's
comprendidos y no
possible for
como algo que
care,
debe ser asumido
work,
exclusivamente
and
por las
tasks
mujeres.
to be shared and not
Otro
something that
aprendizaje
should be
fundamental es
exclusively
todo lo que
assumed
tiene que
by
ver con
women.
las normas
Another
sociales. Si no
fundamental lesson
logramos transformar las
has to
normas
do with
sociales
social
que
norms.
nos han
If we're not able to transform
indicado por
social
siglos que
norms
las
that
mujeres
have
somos las únicas
stated for
responsables de las tareas de
centuries that
cuidado,
women
pero que
are
a
the
su vez
only
han reforzado
responsible
las creencias y los
for
comportamientos
care
de que somos las
tasks,
que
reinforcing the
mejor
beliefs and
cuidamos, pues
behaviors that
difícilmente
we are the ones that
vamos a
care
avanzar en esta
best
agenda. Y
and
además
better
de
than
eso, si no
anybody
transformamos
else,
las
we will
normas
not
sociales,
be able
difícilmente las
to
tareas de
advance
los
in this
cuidados van
agenda.
a ser
If we do
asumidas de
not
manera
transform
compartida por el
social
Estado, las
norms,
comunidades,
it will
el
be
sector
difficult
privado y,
for
por
care
supuesto,
tasks
los
to be
hombres y
assumed
las
in a
familias.
shared
Es
manner
así
by
entonces que
states,
desde el IEP
communities,
también
the
venimos
private
trabajando
sector, and
la
of course,
transformación de las normas
men and
sociales
their
como un eje
families.
central
So
para
in we
avanzar
effect,
tanto en
we've
el derecho
been
al
working
cuidado
on the
como en el
transformation
derecho
of
a la
social
vivienda
norms as a
cooperativa.
central
Y
access
es
to
así
advance
entonces
both
que
in the
también
right of
hemos
care as
aprendido
well
que
as in the right
cuidados
of
y
housing.
cooperativas
We
pueden
have
estar
learned
organizados de
that
manera
care and
colectiva y que
cooperatives can be
definitivamente si queremos
collectively
avanzar, los
organized
cuidados
because if we
tienen que
truly
estar
want to
como
advance
parte del
care,
modelo de cooperativas,
has to be
del modelo de
an
vivienda cooperativa.
intrinsical part
Y por esta razón es
of
que
the
actualmente en
cooperative
WeEffect, luego
housing
de
model.
20 años de
That is
acompañamiento
why
en la
in We
promoción de
Effect,
este
after
modelo,
20
estamos
years,
diseñando una nueva
side
fase
by
del
side
programa para los
promoting
siguientes
this
10 años
model, we're
y
deciding
estamos
a new
incluyendo
phase
como
of the
parte de
program
ese
for the
modelo que
next
llamamos
10
SEBAN,
years, including as part of
los
this model
cuidados
that we call
comunitarios,
SEBAN,
porque está más que demostrado a
community
partir de
care.
las experiencias que ya hemos
Since it's
acompañado que
more
si no están los
than
cuidados como parte del modelo de vivienda cooperativa,
fundamentally
pues por supuesto que vamos a
evidence
avanzar
that
en el
if
derecho a
we
una
don't
vivienda, pero no
have
desde la mirada
care
de la
as part of
justicia
the
de género y la
cooperative
justicia
housing model,
social.
we will not be
Y por
advancing the
supuesto, o sea,
right of
todo esto
housing,
nos ha
and we
ofrecido
won't
una gran
offer
cantidad
a justice,
de
a social
posibles
justice and
rutas
gender
para que
justice
WIEFET a
onto
nivel
it.
global
We have
pueda
offered
avanzar entonces
different
en la
routes
definición
to
de una
advance with We
política que
Effect
actualmente
globally in
estamos
the definition of
trabajando
a
y
policy
que está además
that will
colaborando para que
collaborate
tanto en África, en
so
Palestina
that
y en
both in
Europa, donde
Africa,
tenemos presencia,
Palestine,
podamos
and
ver
Europe,
de qué
where
manera
we're
podemos
present,
integrar
we
la
can see the
perspectiva de
way
los
to
cuidados
integrate
en los
care
procesos de empoderamiento
perspective in
económico de las
economic
mujeres, pero
empowerment
también en nuestro
processes for
programa
women,
del derecho
as
a una
well as
vivienda
in the program
cooperativa.
of the right
Específicamente
to a
hemos estado
cooperative
en
housing.
diálogo
We have been
con ONU Mujeres, con
specifically
Moldova, para ver de
dialoguing
qué
or
manera las
speaking
experiencias
with
que hemos
women in
desarrollado
the
en Centroamérica
UN women
pudiesen ser
offices
adaptadas
in
en nuestros
Moldova to
países.
see
Por
how
supuesto,
we can
no todo
develop
ha
and
salido
adapt
perfectamente,
their
pero
experiences
al
in
ser
Central
procesos en los
America.
que
Not
estamos
everything
empezando
has been
y que estamos tratando
adapted
de que se puedan
perfectly, but
incorporar
within
como
the
condición
processes that we're
básica
trying
para
to
avanzar
incorporate
en el derecho a la
as
vivienda, por
basic
supuesto que también
condition
enfrentamos
to advance in the
desafíos
right of
que están
housing,
más
we have,
allá
of
del
course,
control de las
faced
propias comunidades, porque por
challenges that
supuesto
fall
están
beyond the
conectados con el
control of the
tema de
communities
acceso a
themselves
financiación,
because they're
acceso a la
connected
tierra, pero por
with
supuesto también
financing access,
generalmente nos
land
topamos con marcos
access,
legales que no
and legal
necesariamente nos
frameworks that
permiten poder
not necessarily allow us to advance in the way we wish. As always, we know that experiences cannot be replicated exactly equally, but they should and must be adapted to the conditions and context of the countries where we
Y
would
miren,
like to
yo
advance.
sí quisiera dejar como un
I
mensaje ya
would
para
like to
cerrar, porque
leave
yo
you
creo
with
que
a
el tiempo
final
me lo he
closing
consumido. Y
message
yo sí
since
quisiera
I
decir
took all my time
que
already.
sin comunidad,
I would
pues
like to
no hay
say that with no
vivienda
community,
cooperativa.
there is no
También sin
cooperative
comunidad no
housing.
hay
With no
cuidados y sin
community,
cuidados
there
no puede
is no
haber
care.
comunidad y
And
tampoco
without
debería de
care,
existir
we
la
cannot have
posibilidad de una,
community nor the
la posibilidad
possibility
de poder avanzar
of
en
advancing
nosotros derechos.
in
Y
any other
este es un
of the
mensaje
human
porque
rights.
hemos
I
visto de
chose
que
this as my
efectivamente
message because
cuidados
we
y
have
vivienda
seen
no
that
pueden
care
ser
and
agendas
housing
separadas,
cannot
como lo
be
dije al inicio.
separate
Que
agendas,
deberíamos de
as I
asumirlo
said in the
entonces como
beginning.
parte
So it
fundamental
should be
para
assumed as a
sostener la vida.
fundamental
Y
part to sustain
definitivamente
life.
las cooperativas
Now,
nos ofrecen
definitely,
la posibilidad de
cooperatives
conectar
offer the
esos dos derechos,
possibility
cuidado
to
y
connect
vivienda, para que
both
entonces se puedan
rights,
convertir
care
en
and
derechos para
housing,
todas las
so that they
personas
can
y no
become
solamente
rights for
privilegio para
everyone and
pocos.
not just
Entonces, eso es lo que
privilege
yo
to
quisiera
some.
compartirles. Entiendo que
That
vamos a
was
tener
what I
espacio
wanted to
para
share
preguntas
with
y
you. I
comentarios en donde
understand we
con
will
todo
have a
gusto podré
Q&A
profundizar en lo que ustedes
space,
consideren
and I
requerir.
will be able to go in
Muchísimas
depth
gracias.
with what
Muchas
you
gracias, Damaris.
deem
Muchas gracias por presentarnos
appropriate.
ese trabajo que está
Thank
realizando
you,
New
Damaris. Thank you
desde
so
esa
much
visión
for presenting the work that we effect
de
is
desarrollo internacional.
introducing from this international
Verdaderamente
development
esos
outlook.
proyectos que nos presentan
Those
los
projects
hemos
that are
ya
being
empezado a investigar igual
presented
desde Cooperativa
have been
de las Américas y nos
investigated from
parecen
Cooperative of the
verdaderamente ejemplos
Americas
para ser
much
replicados
much
de
further,
toda
and we
la región
consider them
latinoamericana.
examples to be
También abarcabas un
replicated
par de
throughout
temas
the
muy
Latin
importantes,
American
como lo
region.
es
You
de
also
que
touch on a
el
couple of
cooperativismo de
important
vivienda,
topics.
la
In
economía
housing
ya tiene que estar
cooperativism,
inserta
the
dentro de
economy of
esa
care
visión
should be
de
inserted
vivienda
within
cooperativa,
the vision
principalmente por esos
of
principios y valores
cooperative
que nos definen
housing,
a las
mainly
cooperativas,
because of the
especialmente
principles and
ese
values
interés al
defining
bienestar de la
cooperatives,
comunidad,
mainly
verdaderamente
the
tiene que
interest in the
ser en
community's
todos los
welfare.
ámbitos y uno
That
de ellos
should
tiene que
permeate
ser
every
la economía
single
del
scope,
cuidado.
and one of them must be the economy
Vamos
of care.
por el bien del tiempo, vamos a pasar con nuestro
For
siguiente panelista, que
time
es Emilio Émolo,
keeping,
quien es
Emilio
asesor legal
Emmanuel,
de
the legal
Cooperative Care
advisor of
Solidaridad.
Cooperative
Perdón, Emilio, si desperdié un
Solidaridad.
poco el
I'm
nombre, mi
sorry
italiano
if
no es muy
I
bueno,
messed
pero
your
adelante,
name,
Emilio,
but
tienes 12
Feder
minutos.
Solidarietà Cooperative is your chance. You have the
Yeah.
same 12 minutes.
Thank you, Carlos. Thank you for the opportunity to share the experience of the Italian social cooperatives. Do you see my presentation? Is it all right? Thank you very much, Annalisa. Yes, as Carlos said, I'm legal advisor of the Cooperative Feder Solidarietà, the Italian biggest association of social cooperatives and social enterprises in Italy. So there will be a legal part of my presentation. I'm sorry, but I think it's very important to share the Italian experience with you, because the model of Italian social cooperatives, it's a model at European level and international level too, as the UN standards for social cooperatives demonstrates. First of all, the Italian law and Italian experience of social cooperatives begins in the 70s, in the 80s, for the needs of innovation to new social needs not covered by the traditional welfare system. In particular, in the 1991, the Italian Parliament recognized a special type of cooperatives, because you know that the first aim of cooperatives, the benefit of their members. In social cooperatives, the aim is the social integration of citizen and human promotion of the communities. So an external mutuality. Social cooperatives are no-profit organization, and they are cooperatives, but as we can see, they have a particular objective. We have two different types of cooperatives that in Italy we call A cooperatives and B cooperatives. E cooperatives manage social services, educational services, training services, and housing services in particular, we will see. And Type B cooperatives are very particular cooperatives because the aim is the inclusion of disadvantaged people to the production of services. And for the Italian law, the 30% of the workers had to be disadvantaged people. People with disabilities, people under psychiatric treatment, prisoner and former prisoner, people with drugs and alcohol problems, and minors of working age with problems in the families. So it was very important for the Italian welfare system, the development of social cooperatives in Italy. The pillars are that we have social cooperatives are no-profit organization with a general interest mission. We will see the multi-stakeholder governance, and they are cooperatives, so the democratic and the participatory identity. It was very important for the development of the movement, the role of consortia to link all the little cooperatives, social cooperatives around our nation. It's very important, and we will see for the housing, that in Italian social cooperatives, there is a multi-stakeholder governance. So there are the workers and disadvantaged workers that they had to be members of the cooperatives. Disadvantaged people in Italian social cooperatives are not only workers or users, are members of our Italian social cooperatives. Then there are volunteers, and there are, of course, users, and at the same time, because we are social enterprises, and so there are investors and donors that are members in our social cooperatives. So I will give you some example, in particular around the housing. In this year, social cooperatives have developed a number of innovative social services. In particular, in terms of housing, I would like to share three, I think, very important experience of housing. First of all, an innovative experience concerns residents or people with mental problem. In 1978, mental hospitals were closed in Italy, completely closed. And so there's a special housing experience were developed with people that live with the supervision of social cooperatives workers. Actually, in Italy, everywhere there are communities with people with mental problem that in Italy that are not, can I use the word prisoner in a place, but they are free to live in a common house under the supervision of social cooperatives. The second experience, very innovative, I would like to share with you around housing. It's the experience that in Italy we call after us, dopo di noi. It means that is housing for people with high disabilities without family support. This is an innovative service that social cooperatives are developing and very complicated because there are people with disabilities without family support, and we need to guarantee a service for a long period for all the life of these people that are not only users, are members of our social cooperatives. And the third social housing experience, very new, I had to say. In the recent year, we have developed social housing services for women victims of violence. Unfortunately, there are services that we are developing in Italy too much because they meet a real need in Italy of women that can live with a whole family, and they need a new house with children. In some cases are without address house, we call, because they can say where we are living to protect women victims of violence. In this moment in Italy, there are 14,000 social cooperatives with 500,000 workers. So in Italy, the Italian movement of social cooperatives is very, very wide. And there are 40,000 workers with problems working in our social cooperatives. Actually, our organization associated 6,000 social cooperatives with 250,000 workers and 9 million of turnover. We have cooperatives in every municipality of Italy, and our association give assistance in Italy at national, regional, at local level, because it's very important for the development of services that, first of all, the law recognize the rights to these services, so no-profit organizations, social cooperatives, and social enterprise can develop this kind of services. So it's very important, the political support of the cooperative movement in Italy, first to recognize the right of people with disabilities, women with problem, people with mental problem, and then the possibility to recognize the services, to develop the services. I think 10 minutes, Carlos. It's all right. Thank you very much.
Muchas gracias, Emilio. Bueno, de
Thank
mi
you
parte,
so
siempre
much,
como
Emilio.
moderador,
On my
agradecerle
behalf
eternamente
as a
a los panelistas
moderator, I
que
will
sacó tan al
be
tiempo.
forever
Has cubierto
thankful
algunos
to
puntos muy
those panel
interesantes. Hago de
members
una
that
vez el
keep
link
to
con lo
their
que
time.
mencionaba Damaris también en cuanto a la legislación.
Interesting, let
Es
me
sumamente
link
importante
what you
que
said
las
with what
cooperativas
Damaris
cuenten con una
said
legislación
regarding the
que les
legislation.
permitan desarrollarse
Cooperatives
al
should
potencial,
have
totalidad de sus
legislative
capacidades.
frameworks that allow them
Aprovecho para
to
hacer el
develop
speech
at the
comercial que de
fullest
Cooperativas de las Américas
extent
estamos haciendo
of their
un análisis de los
capacities.
marcos legales
In the
por sector,
Cooperative of the
juntamente con la
Americas,
subsidiaria del
we're
informe para el
analyzing the
sector de las
legal
cooperativas de
frameworks
vivienda.
per each
Emilio también
sector, and we
mencionaba
will
un
have
poco
the
acerca
report
de todo ese
ready
rol que están
for all
teniendo
the
ahora las
housing
cooperativas
cooperatives. Emilio
sociales
also
en
mentioned the
Italia, desde
role that
la
social
perspectiva de los dos
cooperatives
tipos que hay
are
actuales en
having
las
in
cooperativas
Italy from the
sociales,
two types
del
of the
tipo A, pero
perspectives that
también aquellas
he presented,
cooperativas
those
sociales
type
del
A
tipo B que
and type
principalmente
B, which
se enfocan
mainly
hacia
are
las personas
focused
desfavorecidas. No
towards
solamente
the
debemos cuidar a las
unfavored
personas
sectors
que se
of the
encuentran en una
communities, not
situación
only caring for those that
desfavorable, sino que
are
también
in
debemos darles esas
unfavorable
oportunidades para
situations, but
integrarse en la
also
economía
offering them
hasta donde sea
opportunities
posible
to
y
be
a través de
included
las
in the
cooperativas
economy
sociales de tipo B
to the extent
verdaderamente
that
se
it's
le brindan
possible. And
esas
so through
oportunidades a todas las
social
personas
cooperatives, we
en
can
esa
see
área.
that they
Asimismo,
truly
también
are offering
mencionabas
these
todo el trabajo
opportunities
que
to
hacen
the
desde las cooperativas
disadvantaged
sociales en torno
populations. You
al cuidado,
mentioned the
mencionabas,
work
por
in
ejemplo, el
social
tema de
cooperatives
escuelas,
regarding
centros de
care,
cuidado,
mentioning
inclusive
care
para niños, pero
centers,
también para personas con
not only
discapacidad que
for
no cuentan
children or near
con
schools, but
una
for
familia
people with
que los pueda
disability
cuidar
who do not have family
atentamente y como lo merecen. Así
support
que
as
creo que
they
todos nos llevamos
deserve.
grandes
So I
aprendizajes
think that
de
we
las cooperativas
all
sociales de Italia, pero creo
have
que también
learned
nos
great
llevamos la
lessons
tarea de
from the
poder investigar
social
más.
cooperatives
Sabemos
in
que es
Italy and the
prácticamente imposible
homework
abarcar todos
to
los temas
research
en
even
apenas 12
further.
minutos,
We know
pero
that
creo
it's
que
almost
ha sembrado en
impossible
nosotros
to
una
reach the full
semilla de
scope in
interés
12
para poder
minutes,
investigar más
but we
acerca
think
del
that
tema.
you have
Muchas gracias,
sowed
Emilio.
a seed of
Pues
interest in
bueno,
all of us in order to
ahora a
research
continuación voy
further
a
into
hacer
it.
el paso de moderación
Now
a
I'm
mi
going
colega Annalisa
to
Balone
move
para que
into
continúe con
Annalisa
la segunda
Balone
parte del panel.
so that she
Adelante,
can
Annalisa.
take over the second half of the panel. Go ahead, please.
Thank you, Carlos. Thank you also, Emilia, for for the great presentation. I'm also Italian, so it's always good to learn a bit more of also how what my country is doing and how it's faring in COP development. It sounds super interesting what we're hearing. I think there's also a fil rouge that are able to draw, even though we've done our own homework to seek for the best cooperative stories and link all of you together. So without further ado, we move to this second part of the panel, which will focus interestingly on the same group of society, which is more on elderly care. And it's with great pleasure that we fly back to Latin America and specifically to Uruguay to give voice to Beatriz and Luis, who have a very innovative story to tell on how the elderly can be included into territorial redevelopment, inclusion in the local economy, and then can lead to a sustainable model advancing the economy, but especially all human rights of a sector that is sometimes left aside because maybe too old. So over to you, Beatriz and Luis.
Bueno, buenos días a todos, a todas. Es un
Hello,
gusto
good
muy
evening to
grande
all
poder
of you. It
compartir
is a
nuestra
source of
experiencia
true pleasure
en
to be
este
able to share our
espacio
experience
y bueno,
in
seguir
in
aprendiendo y
this
seguir adentrándonos en el sistema
event,
económico
to continue
que
to
nos
learn and
arropa
get involved in
permanentemente
the
y con el cual nos
cooperative
sentimos
movement
totalmente
that
identificados.
constantly
Somos Beatriz y Luis de la cooperativa
embraces
Caring.
us, to which we
Bueno,
feel
capaz que
fully
ya
identified.
empieza Luis a
We're
contarles un
part
poquito
of the Carpe
de
Diem
nosotros y
Montevideo
vamos a hacer un poco
Uruguay
hincapié en,
cooperative
bueno, cuál es la
model.
concepción de cuidado que
We would like to
necesitamos.
start with the conception of care that we are
Muchas
using
gracias,
currently.
buenos
Thank you
días.
so much
Bueno,
and good morning.
rápidamente para que
We
Beatriz
would
ahonde en
like to
este eje de salud y
quickly
cuidados. Bueno,
start
es un
with this
grupo de
axis
personas
of
mayores de
care
50 años que ha constituido una
for a group
cooperativa,
of
como
people
se ha
older than
dicho,
50
arropada del sistema
years
cooperativo
old
uruguayo,
that
como
has
se ha saludado.
constituted a cooperative
Compartimos una serie de valores.
surrounded by the Uruguayan
Nuestra cooperativa es
cooperative
de cohabitación y
movement
cuidados y
that
es para
with which
mantener
we
ese proceso de
share a
solidaridad,
series of
cooperación, compromiso,
values.
autonomía y
It's a
asociación en una etapa determinada de la vida,
habitation or
pero con
co-living and
envejece,
care
tercera edad,
cooperative
etcétera. Pero en
to
definitiva
maintain
es
the
los últimos
solidarity,
50 años de nuestra
cooperation,
vida como
commitment for
país
autonomy and
en el mundo.
self-management in that
Bueno, ¿qué
determinate and
buscamos? Bueno,
crucial
convivir en
stage in the
un
life
entorno
of
importante, interactuar
its
con la
um,
comunidad, contar con los servicios
users.
necesarios
The next 50 years of our lives, as we say in our group, looks to share in a very important manner, to interact with the community, to have the necessary service. This economy, it tries or intends to optimize scale economies, sharing moments with neighbors and friends in a solidarial manner. In a topic of care at the extreme ages with needs and dependencies that require specific architecture and spaces that are accessible and comfortable, that have to do with urban planning, technology, and environmental topics, as well as cultural and social ones. And of course, to have fun, to live in the present and to be productive. We will be more productive in further stages of our life than we did in our youthful beginnings. Basically, surrounded by a proactive, autonomous, and collaborative manner, improving quality of life for us and for the members and the families. We know how difficult it is for families when we reach that age. Now, this arose in history because a group of us said it would be lovely to live within a group of friends when we reach certain age. That was the idea, and the group started to grow with that idea. So we decided to do this within the cooperative system. It's a cooperation of co-living and care services. We allow the cooperative system in Uruguay was supporting us with a tool of the state that allowed us to achieve that. It's an incubator tool for pre-cooperative ideas that is called Incuba Coop in Uruguay, an incubator pre-cooperative tool that can allow you to have a tax ID and to advance in the most important things, architectural and business plans. When we start with this care system, we worked until we chose the location that we wanted to, a rural zone in the department of Montevideo, which is the capital of our country. From there on, we were able to be awarded a special waiver from the government to acquire the land among the members of the cooperative, generating the interest and the creation of new spaces, finishing the architectural plan. In Uruguay, there is a collaborative housing coordinator cooperative that many know. We call them housing senior programs. In Uruguay, our cooperative and other three organizations are working side by side to strengthen this and to turn it into a tool to define a stage in life in a different way, if you allow me to quote a paradigm, away from passivity and old age. Before I yield to Beatriz, I'm so happy to present our architectural and pre-project, a set of 38 housings individually or in couples to develop a great zone of common spaces, developing a series of activities, defining within the process that comprises the time frame from now on until the final delivery. We can build a specific installation. Now I am, because when we're no longer able to do it in individual housing, we try to do a specific facility for other options. Now, Beatriz, how did we organize beside the whole formal system? Well, what are the concepts that organizes? That is the question that we ask. In Uruguay, we were able to organize. It took us a long time and it was very hard to come up with a status because, as you all know, the hardest thing is to fight against the legal framework. We are paying the cost of innovation in this term with pioneers, and we're open the route for others. The other important axis is the social axis. We have very diverse trajectories among the members of the initial project. Each of us are using our own experiences and context for the personal growth of these social model in order to make it replicable and fully alternative to the current solutions offered to old age individuals. In Uruguay, the healthcare and care access has to highlight urbanistic, environmental, urban planning, co-designing architectural plans where the permanent accessibility, enjoyment, and comfort play a central role. For all the co-housings, full and broad management of the common spaces and the environmental spaces. There's a few agricultural engineers and agricultural workers among the members of our cooperative. So we're fully invested in common orchards and common herb gardens and sustainability food crop creation, space creation. Many of the things that have to do in the economical side, sustain sharing expenses for healthcare, the circular economy, scale economies, to make this dream come true. The first thing that we want to achieve is self-management, self-care. Everything that has to do with healthy food intake, physical exercise, healthy nutrition intake, intellectual exercise, avoiding just being alone, the loneliness, the undecided loneliness, which is a very important part that occupies the mind of all elderly people. In our country, that is quite highlighted. I can't give you numbers, but it is. The other thing is to be aware and touching and connected on everyone else, to be willing to respect the spaces of those that wish space, and the availability to help, to aid is the most relevant thing, to be watchful among all of us. That is what we want to foster, that anyone that needs a hand knows that that hand will come. It is possible that we can precise specialist case where dependence or permanent assistance degrees increase. Any healthcare problems that we have studied through a national survey is the way we try to overcome these healthcare problems. We know that in a population like us, which will include 46 individuals, at least 8 of them will require specialized healthcare. We need to care each other based the concept of comprehensive central care for each one, respecting the trajectory and the living history of each of us, autonomy as much as possible, and the willingness to develop and care for the spaces, the generation of adequate infrastructure from full accessibility, internal comfort of the housing, individual or couples or group, balancing between the private and the collective, the private and the communitary is very relevant as well. The space has 7 hectares, which two
Transmisión
beautiful
Fondo
forests
Salud,
and
que debe
food
atender las
production, which
necesidades
is
especiales.
one of
Aclarar
our
que en
passions as
Uruguay
well, the
el derecho a
infrastructure
la salud
for a space that we
tiene
can
un sistema
call home
universal
with
llamado
health
Fondo
and care.
Nacional de Salud
More than
y
five
que
of them
tiene
will
una ganancia
require
de
permanent
prestaciones muy
care
amplia, de las
in
más
terms of
amplias de
health
América
care. We
Latina,
will create a
pero
health
de la parte
fund
de
that
cuidados
will take care of
privado
those needs. In Uruguay,
para las personas que sufren
universal
algún tipo
health care is a
discapacidad
human right.
privada de
We call it the
enfermedad,
National
eso está
Health
reservado
Fund,
a un
and
sistema
it
de salud
has
para
a,
poblaciones muy vulnerables,
a
eso que
special
nosotros no
fund,
tenemos y bueno,
one
ahí
of the
muchos
broadest in Latin
nos
America
estamos
for
autofinanciándonos
healthcare.
y buscando
Now,
formas
we are
de integrar
self-financed, and
personas
any of our
que
members
no
that
cuenten
suffer
con
from
los
any
fondos necesarios para
disability due
cuidarse.
to age or
Después el
aging
otro
process
concepto que
will
es
be
uno de los
reserved for
valores
that
o de los
fund
principios del
in a
cooperativismo,
healthcare
que es el
system that will be
intercooperativismo
devoted for the most
equitativo para
vulnerable
recibir los
populations.
servicios, sea de la alimentación
We are looking
colectiva
for
o de
ways
los
to
cuidados,
integrate
ya
other
estamos
partners in order to care
integrándonos
for
a
those
trabajar
that
junto
don't
con
have the necessary
cooperativas
funds to
sociales y de
be
trabajo de
included
nuestro
in
país
our
para desarrollar estos
plan or
modelos.
in our cooperative.
El
The other thing
involucramiento
that we want to
permanente por el
foster,
entorno
one of the
comunitario
values and
y
the
lo que
principles
decíamos
of
hoy, inteligencia
cooperativism is
permanente articulada.
inter-cooperativism.
Bueno,
Now, in
tengo
order to
entendido que
receive
el tiempo
food
está
service
cerrado
and
en nuestras
collective
preguntas,
care
pero
services, we
nuestro
want to
nombre se libra un
connect
poco de
with
este
social and
poema de
working
Whitman
cooperatives
y bueno, de este sentido
in
de
our
vivir
work.
el hoy
Permanently involving
plenamente y
ourselves
bueno,
with the
pensando en
environment,
nuestras
with
actividades
our families in a permanent
duraderas.
disposition to
Muchas
care
gracias.
and to go hand in hand. We have complied with our time and we will be only too happy to answer your questions. Our name, it comes from the Walt Whitman poem, The Sense of Living Today Fully, thinking about an active and long-lasting age.
Compañeros uruguayos. Soy de la FUC, Federación Uruguaya de Cooperativas de Consumo.
Hello, I'm
Excelente.
from La FOC. I'm also
Thank you so
from
much. Sorry, I had
Uruguay,
a bit of delay
and
with
it's
the translation, just to make sure
an
that.
excellent
Can you
presentation.
hear me? Yes. Okay. Yeah, thank you so much, Beatriz and Luis. I was waiting to reply just because the translation, thank you for the interpreters, is doing a great job. So thank you so much, really out loud. And thank you so much for sharing your story. I think it was actually very moving, at least from my perspective, because you touched upon so many interesting points from really a story which was based on friendship and just of a simple request to be considered and to be considered also worth it to still make a contribution in the society. So I really appreciated this. And in particular, I think it shows that the age is just a number. I'm saying it as a youth, but I'm also saying it in your respect from your story, because the ability that you show to innovate, not only from a social perspective, but really to think in a holistic manner of the land, of the territory where you live, also in full respect of it. So you didn't only address a social isolation, but you also addressed a territorial isolation, which is also a key problem nowadays, unfortunately, in the kind of society we live in. So the possibility through Incubacop, all your efforts through negotiations, as you said, law is always the key challenge, but for some reason it keeps being a challenge, even though everyone acknowledges that is the main one with finance. But that shows really that commitment to a simple message works. And I think what is very relevant in your case, it's not only the ability to make a link to housing rights, but actually to link your cooperative to multiple sectors and to create a local cooperative ecosystem which is inclusive, is accessible, and doesn't pose any barriers just for the services that it offers. So I'm deeply thankful for this, and you also give me the opportunity to move to our last speaker of the day. Flying back to Europe, and this time to actually keep a European focus, so to have a macro look, not a national level. So we go back a little bit like in like Damaris did at the beginning, and I'm happy to introduce you to Alice Titini. She is research director of Housing Europe, which is our European sectoral member focusing on housing rights, on social housing and cooperatives. And I'm very happy to hear and also to hear her account of what Housing Europe is doing also for ensuring independent living, especially through a recent project. So Alice, the floor is yours, and thank you so much for joining us today.
No, thank you, Annalisa, for the invitation. Can you hear me okay? Yes, okay, excellent. I'm going to share my screen, and I will be indeed presenting to you today some well, preliminary at this stage findings from a project that we've been working on together with a rather broader partnership, including cooperatives in different sectors. Can you, sorry, just a second. I'm trying to go echo. Working. So, but maybe first of all, let me start by just saying in a very few words, what is Housing Europe, the organization that I represent. So we are indeed a European network of public, cooperative and social housing providers. We are a rather broad network comprising at the moment 43 members in around 30 countries today. Our members work indeed in very diverse sectors, as I mentioned before, from public to cooperative, other third sector organizations. But when it comes to co-ops, which represent roughly half of our membership, we also work in cooperation with Cooperatives Europe. We are members of COOPS Europe indeed, and we have recently started a very close collaboration with the Global Cooperative Alliance for the Housing Sector. So what I'm going to talk about today is indeed a project that we're working on, focusing on housing solutions for independent living, with the focus on making sure that people with disabilities can lead independent lives in safe housing environments. The project, which you have the logo here, and of course the website of the project is already online, started with this idea of taking stock of existing experiences and practices that focus on independent living from a perspective of housing, but also care services, and with the inclusion as much as possible of digital technologies in the housing environment. I have to say we are not technical experts, the organizations involved in the project, so we kind of took a different perspective, trying to see within our respective sectors what is the state of the art of technologies, what are the pros and cons of using these technologies, and how can we learn from the existing practices. So the starting point of the project is, of course, linked to the UN principle that sees that people with intellectual disabilities, in particular, have the right to live independently as part of the community, and they should be entitled to the same range of housing opportunities as any other citizen. And we also are aware that although there are a range of interesting opportunities out there, there is still much to be done to promote housing that encourages self-determination and social participation for all people, actually. We also wanted to include this aspect of trying to understand to what extent the smart home developments and the new technologies that exist are able to support independent living through supporting autonomy and help make more accessible the different housing solutions. And to this goal, what we started to do is a big scouting exercise. We launched a call for relevant projects and innovative experiences. And through the first 6 months of the project, we have gathered around 35 examples from 7 countries at the moment. So we have quite a good and very diverse knowledge that we collected from the ground, from the projects that exist across Europe. And we're trying to analyze these experiences to try to understand what are the common challenges and the success factors. Also very important to highlight, it's a diverse partnership involved in this project that sees a participation of both social housing providers, cooperative housing providers, but also providers of services for people with disabilities. So people whose daily job is basically to work on the care and individualized assistance to their users. And we are a consortium of 7 different organizations. 2 of them are European networks. So there's us, and there's ARFIE, which is indeed a European association working on disseminating good practices. And a number of organizations at the national level who are also involved in Italy, Spain, Portugal, and Finland. So I just wanted to give you some examples today of the type of good practices that we've been identifying. And indeed, we have many. And I have to say, it's important to highlight that there practices linked to housing and independent living, but they're both led by housing organization. But there's also a strong tendency that we see within the care sector. So for instance, what would be in the case of Italy, the social cooperatives that were mentioned by the presenter before me, to starting from indeed the need to provide individualized and good services, to move into housing because there is a lack of housing opportunities existing on the market. There are indeed adequate, there are accessible, and they are also affordable for the users of these services. So it's both housing organizations going more towards providing care, but also care organization going more towards providing housing. And I think this really proves that there's a real need to work together on this project and create stronger multi-actor partnerships. But so I picked, among the many examples, I picked a few that actually come from the cooperatives or third sector world. And I think they are very interesting because we also have a lot of examples that come from the public sector, for instance, that are also very good. But I think what is particularly interesting in this context is the capacity of cooperatives to adapt to the needs of their members, and also to have initiatives that are strongly bottom-up. So they're led by the residents, together with the residents, to correspond to the specific needs. So the first example is one in Berlin, which I also wanted to include because the German housing cooperatives are a really large and very strong sector with a very long history, and one that is very well known, I think, across Europe and also in Germany as an example of indeed democratic governance and also affordable housing option for a broad range of people. So this case in particular, it's a large housing estate in Berlin, which was built at the end of the 60s and in the 70s mainly, and by one of the largest housing cooperatives in Berlin. And what is interesting is that most of the people who started the cooperative actually are still living there today, which means the neighborhood has seen a strong aging of the resident population over time. So when the time came to actually renovate these homes, because there was a real need for structural renovation, and also because they wanted to adapt to environmental and energy efficiency requirements, it became an opportunity to actually adapt to the changing needs of the residents. So the process was really led by architects and engineers, but at all stages, the residents and some of the social and healthcare associations in the area were strongly involved. So in the end, the residents wanted to have something that could favor social mix with co-housing solutions. In the end, a part of the existing estate was extended to include also student housing, together with the different type of housing solution existing, and also common areas were renovated and were adapted to include a gym, a community hall, a cafe, urban gardens, and also, for some reason, not appearing on the slide, it's my fault, but it was decided to include, to transform 10 apartments into apartments that include indeed domotic technologies, with the idea that older people could move in there to continue living in the area and leading independent lives, but in a more assisted environment. And this was done together also with some healthcare organization in the area that actually provides additional support. So, and it's really considered an exemplary example that actually was receiving a lot of attention and some awards at European level. Another example from Italy, and I could have mentioned many more, including some that were mentioned by the previous speakers, like the ones that are led by the Dopo di Noi, so After Us Foundation, which is really, really interesting case of cooperation of associations dealing with, created by families that have members who live with some disabilities, and housing cooperatives and the local authorities. But I will talk about a different project. In this case, it's again a rather big housing cooperative that is active in the Piedmont region. And in this case, in Orbassano, it's an interesting case of social housing with inclusion of people with disabilities. And the idea that really was the driving idea for the project was to have a housing estate that would allow people with severe physical disability to live together with other residents without having to be living in a specific or secluded part of the estate. So what, from an architectural point of view, was indeed key to have removing barriers, of course, and obstacles, both in the apartments, but also in the outside parts. But also, quite interesting, the design of the apartments is flexible in the sense that it was made with the idea that the housing units might have to be adapted over time to adapt to the changing needs. So typically, for instance, the possibility to easily include an additional room, for instance, for care providers who would come to support on a daily basis at home. It's also interesting to see the cooperation with different actors. So, for instance, there's a social cooperative in this case that organizes all sorts of leisure, but also training activities in the common areas. And this project is also undergoing social impact assessment by the University of Turin to be able to show indeed the potential positive impact of this kind of initiatives. The last one is from an association in the Netherlands. Again, this is another project that won also international prizes, including the World Habitat Award, and it's called Space S. so led by a housing association. What they did in this case, which the idea is basically they were assigned a former industrial area to be redeveloped into a housing community. So what the association did is they opened a call for potential residents who would like to go and live in the new project once it was finalized. And then after indeed a selection of participants, then the whole redesign project was done together with the prospective residents. So of course, taking into account their needs in terms of quality of accommodation, of green areas, similarly to what was mentioned in Uruguay, I think the environmental. Yeah.
Alicia, sorry. Yeah, sorry for coming in. If you can just wrap up for time management, so we make sure we have some Q&A.
Oh yeah.
Before
sorry.
closing.
Yeah, no, absolutely. I didn't
sorry
notice
for
them.
stopping here. Yeah,
That's
sorry
fine.
because it's very interesting. So sorry.
So
Go
I
ahead,
think
please.
the lesson learned. So of course we need a diversity of solutions, and it's important to this goal to involve inhabitants and include their wishes and to have different options. Of course, that the partnership, I couldn't stress it enough, between the different actors and services providers is key. And also, there's always a problem with not being able to secure stable funding for initiatives. But I think we should be able more and more to show that investing in this kind of supportive housing solutions can also bring high social returns and even savings for the public purse. So I will leave it there. Sorry for taking a bit too long.
No problem. I'm really sorry for interrupting because it's not nice, but it's very interesting, and I think there was a lot of also links within your comments and the experiences also recently shared by Beatriz, but also Emilio and Damaris. I would say the innovative point of this of your presentation and your project, which it can be a good lessons learned. It's exactly the question of adaptiveness. So really already mainstreaming the accessibility needs and the aging population factor from the renovation, from the design, from the construction, and the fact that there are people behind all these activities makes it even more relevant because they're the first to experience these specific needs, and the fact that disabilities are a different spectrum, but they're not inability to act. They just need to be addressed in a specific way, which needs a little bit more time, but we saw there can be a lot of commitment. So this said, I would like to maybe we give a few minutes, 5 to 7 minutes for questions from the audience or comments, also questions to the participants, but equally some comments or a personal experience maybe among people from the audience who act in the sectors or would like to share some other experiences. We very much welcome them. So if you are interested, raise your hand. And if not from external audience, if any of the speakers have questions for each other, also feel free to raise your hand. Thanks. I think there's a question from the chat to Beatriz and Luis. Carlos, just correct me if I'm wrong.
Okay.
So
The
Beatriz,
question in the
please.
chat is for Beatriz and Luis. How were you able to finance the purchase of the 7 hectares you have? Well, we're doing under a capital cooperative model, but there is a capital co-op model, but there's clearly a target population that doesn't have access to the capital levels that they require. So we are integrating capital and partners working alongside financing sources because some of the users had to sell their own houses in order to have access to Carpe Diem. It's going to require financing for a certain period. And then we have other savings and loans co-ops that can help us because many of the users either don't have a plot of land or a house to sell or anything to sell to be included. But the hectares that we have acquired, we acquired them between the partners that we're already involved. Seven partners initially. Now there's 20 of us that need to provide equity to foster that capital. Now, when we start the building that we hope it will begin at the beginning of next year, we haven't had the luck to find any other fundings. So we're looking for the housing coordinator to have subsidies, waivers, or to have access to other kinds of credits and loans that would be appropriate in our ages for other people that do not have the initial capital to purchase their equity in it. Thank you.
Pidió la palabra María Sena. Adelante,
María Sena.
Sí, buenos días a todas y a todos.
Yes. Good
Soy María
morning
Sena
to
de
all of you.
Uruguay,
I'm Maria Sena from
consejera
Uruguay.
cooperativista de la
I'm the
Federación Uruguaya de
co-op
Cooperativas de
counselor
María,
from the
un
Uruguayan
segundo. En el Zoom abajo
Consumption
hay
Co-op.
un icono como de un
Maria,
logo
can you
que
please
dice
join the
presentación. ¿Puedes seleccionar el
interpretation
canal de
services,
español, por
please,
favor,
and
para que
select
te
the
puedan
Spanish
escuchar todos los
channel?
idiomas? ¿No, ¿nos escuchas, María Sena?
Can you hear us?
Creo que tuvimos
I think she logged
un
out.
problema con María. Vamos a ver si sigue en línea.
I think that she probably
Se desconectó, Analisa.
disconnected, left
Se
the
desconectó
meeting.
María. No sé si tenemos tiempo para una última pregunta.
Do
Tal
we
vez,
have time
Annalisa,
for a final
para
question,
pasar el breve.
Annalisa? And
Maybe, yeah, a quick one. I don't know if also among the panelists, if anyone wants to have clarification or, yeah, from another one, and then I would leave the floor to Danilo for the concluding remarks.
Sabes que no encuentro el icono, perdón.
Maria is back. Maria, can you choose Spanish before speaking
Adelante,
from
Damaris.
No, nada más quería compartir que escuchando
thank you, Damaris.
las lindas experiencias
I
del
wanted to
Uruguay y
share
sabemos que
that
la vivienda
listening to the
cooperativa en nuestra
wonderful
región
experiences
nace
of the
a
Uruguay
partir
and
de la
knowing that
motivación que nos
co-op
da
housing
el
in
Uruguay,
Uruguay is
pero también escuchando
arises
las
from the
experiencias
motivation
de
of
Europa,
Uruguay, but also listening
bueno,
to European
lo que me decía es
experiences.
que tenemos como las bases suficientes que nos inspiran y que
We
a la
have
vez nos
enough
dejan enormes aprendizajes para ver
foundations
de qué
that are
manera logramos
inspiring to
consolidar
all of us
que
and leave
cuidados y viviendas
wonderful
podamos
lessons
considerarlos como
learned to
derechos
consolidate care
colectivos
and
y como
housing
una agenda que
into
deberíamos de empujar a
collective
nivel
rights,
global
being considered
y
as
que, por
collective right
supuesto,
with an
ver cómo
agenda
desde el
that we
movimiento
should
global
drive
cooperativo
globally,
logramos
because from
asegurar que
the
los cuidados
global
sean
co-op
una condición
movement, we
fundamental
should
en la
be able
promoción,
to assure
en
that
el
care
empuje del
becomes
derecho
a
a una vivienda
fundamental
adecuada para todas las
condition
personas
in
sin ningún
promoting the
tipo de
drive
discriminación.
to the
Eso
right
es lo que,
of
por supuesto,
appropriate
dejarle
housing
el
for
reto
every
a la Alianza
individual
Internacional
with
de
no
Cooperativas que nos
discrimination
guíe
so
a
far.
que nos juntemos para
So we
seguir
would like
luchando
to
por por estos dos
throw
derechos
this
de una
challenge
perspectiva
to the International Co-op Alliance so that they can guide us, so that we can continue to fight for two collective rights.
Muchas gracias, Damaris. Estaba
Thank you so
escuchando
much,
y sí, quería
Damaris.
tener a María Cena nuevamente, pero creo que
Maria
está teniendo un
Sena
problema con la
has
conexión.
a
Entonces, pues
problem
bueno,
with her
definitivamente hemos
connection.
contado con cuatro
So
extraordinarios y extraordinarias
we've
panelistas
had
el
4
día de hoy y
extraordinary
como
panel
mencionábamos
members today.
con uno de los
We've been
panelistas
lucky
anteriores,
enough
nos llevamos definitivamente la tarea
to
de
hear
investigar un poco más acerca
from
del
all
tema.
their
Desde
experiences. We
Cooperativas de
have
las Américas
work,
y Cooperativas de
homework
Europa les
to
vamos a estar
research
compartiendo
more
los
about the topic from
materiales,
the
pero
Americas and
antes
Co-ops
de cerrar, queremos tener
of Europe
la
and the
palabra de cierre
Americas
del director regional de Cooperativas de las Américas,
organizations. Before
Danilo
we
Salerno,
close, we
quien
would like to
nos haga
listen
el cierre
to
de
the
este evento y le
regional
doy nuevamente
director for the co-ops of the
las gracias.
Americas,
Hola
Director
Carlos,
Danilo
buenos días,
Salerno, for
tardes
the
y noche
closing
a todas y
remarks.
todos, dependiendo de dónde se
Hello,
encuentren.
Carlos. Good
No
morning,
sé
good
a qué se
evening,
refiere
and
con
good
importante anuncio, pero trataré de
afternoon
sacar
to
algunas
everyone. I will try
conclusiones
to
o
extract some
a cumplir con un
conclusions
importante anuncio si es entendido lo que te refieres.
to comply with
En
what
primera
was
instancia, bueno,
mentioned.
soy Daniel Salerno,
First
director
of
regional de
all, I am
Cooperativas
Daniel
Américas. En primera instancia, quiero
Salerno,
agradecer a
the
ustedes y a ti,
regional
Annalisa,
director
por
of
haber
the Co-ops of the
fuertemente
Americas. I would like to thank
empujado
you
e
for
insistido y dialogado conmigo
moderating,
y con Inés
pushing,
Martí, la directora de Cooperatives Europe, a quien mando
fostering,
un
and
grato y saludo, caluroso saludo para estos
insisting
webinars
on this
que
event along with
inician y espero van a
Annalisa
continuar una colaboración entre la región de Américas y la
to
región
start a
de Europa de la Alianza
collaboration
Cooperativa
with
Internacional,
European
así
co-op
como seguramente lo
directors
haremos porque la
and
agenda de este
Latin
diálogo no
American
solamente
co-op
se ha
directors or members
reafirmado como una agenda
into a
regional en América,
continuous
con la transparencia que hemos
collaboration,
tenido
as we will
en
continue to
México,
do,
una
because the
vez el acuerdo
CARE
de
agenda
CEPAL
has been
y
signed
la
as a
OIT
regional agenda in the
mujeres,
Americas
sino
after the
también que
conference
sabemos
and
ya
the
que a
general meeting
principios
we
de
had in
noviembre,
Mexico,
en unos
organized
15
by
días,
CEPAL
a
and
realizarse la
the
cumbre CELAC,
International
Unión
Labor
Europea, en la ciudad de Santa
Organization.
Marta, Colombia. Se va
We
a
know
firmar
that
este
by the
pacto
beginning of
bilateral entre la
November,
Unión
15
Europea
days from
y los
now,
países
there's a summit to
de la
be
Comunidad de
taking
los
place
Estados
by
Latinoamericanos y Caribeños,
CELAC
que
for the European
evidentemente
Union in Santa Marta,
va a trasladar
Colombia,
en
for
una
the
agenda común el
signature of the
proyecto, esa línea de
directional
financiamiento,
compact among the
también con apoyo de
European
la
Union
Comisión o a
and the
través de la Comisión o a
community
través de las
countries,
delegaciones de
the
la Unión
Latin
Europea en
American
nuestra
states
región,
and Caribbean
la
states
región de
that
América,
will be obviously
directamente
translated
con
into a
la
common
Comisión.
agenda with financing
Y
line projects
esta tal
included,
vez es uno de los
supported by the
anuncios
Commission or
y de
through
las
the Commission and its
informaciones
delegations, the
importante a
European Union
compartir.
and our
Em,
region in the
en segunda
Americas
instancia, me
with
permito, bueno, dado
the
que hay mucha
indirect support of the
simultánea
Commission.
en este panel, me
The
permito
second thing
agradecer
that I
a los
wanted to
colegas
share
y
is
saludar
that
por
there's a
supuesto a los
lot
panelistas
of Italy in this panel.
italianos y al
I would
amigo
like
ex
to
colega
thank our colleagues and
Federica
especially thank the
Emilio.
panel
Es un gusto volver a
Italian
tenerlo
members, my
y
friend
enriquecer
and
realmente
former
saber que
peer,
hemos compartido
Emilio,
mucho tiempo de
molto
trabajo en el
piacere,
anterior
since we have
en el anterior
shared so
proceso.
much working time in
Voy
my
a destacar
previous
algunos
role.
elementos, si le
I
parece,
would like to
y tratar
highlight
de
some
llegar a
elements
los
and
próximos
try to
pasos,
reach
porque en efecto creo
next
que vamos a tener
steps
futuras ocasiones.
because I believe
Bajo
that
la
this
lente
is only the beginning of future
de la
spaces
vivienda,
like this.
ese taller
Under the lens
nos
of
mostré
housing,
algunas consideraciones
this webinar has
importantes. La primera,
brought some
Damaris, como
important
consideraste, es por haber
considerations
destacado que la
into
vivienda y
the
los cuidados no son
scenario or
solamente un tema
stage.
urbano,
Thank you,
sino también
Damaris,
en las áreas
for
rurales,
highlighting that
tal vez tienen un
housing and
impacto y un
care are
nivel
not just
mucho
an
más
urban
severo respecto
topic,
a las
but
áreas
in rural areas have a
urbanas.
particularly high
Evidentemente, eso ya nos
effect and
brinda,
more
y
severe
se lo puedo
impact in
garantizar,
these
dado que estamos en
areas.
Roma con
Obviously,
los
I
colegas
can
de la
guarantee,
FAO, los
since we're
colegas y
right now in
el
Rome
presidente
with
del
FAO
Comité
colleagues,
Regional de Juventud de
peers, and
Cooperativas
the
América, Nicolás
president of the
Achille, que también
Regional
es parte de
Committee for the
Cooperativa
Youth
Obrera y la Federación
in
Argentina
cooperatives or
Cooperativas de
the
Consumo,
youth
vamos a seguir
cooperatives or
trabajando y haciendo un
America
puente,
Nicola
dado
Chaquet,
que hemos
also
estado
part
participando
of
en
the
el Foro Mundial
Working
de
Co-op
Alimentación
and the
y se
Argentinian
recordará el Día
Co-op
Internacional de
Federation
Alimentación el
for
día de hoy y que
Consumers.
es de la mujer
We
en
will
hogares.
continue to
Vamos a seguir
work
trabajando
jointly and
este
trying
tema
to
desde un punto de vista del
bridge
cuidado
this topic,
relacionado al Día
participating
Internacional de
in the
Cooperativas y al
World
Año
or
Internacional de la
Global
Mujer Rural
Food
2026,
Forum.
ya declarado por Naciones
As
Unidas y
you
que Joao
recall,
Alfaro
is
será
today
una
is
agencia
International
implementadora
Food Day
y esto no
and
solamente digo a
International
nivel
Rural
regional,
Women
por
Day. We
lo
will
que ya
continue to work
se
in these
ha
topics from the
determinado,
standpoint of
dado
care
nuestro compromiso
regarding
en
the
este Año Internacional de
International
la
Year of
Cooperativa, sino
Co-ops and
también a
the
nivel
International
global,
Year of
en lo
Rural
que
Women
desde la Dirección
2026,
General de
already
la ASI
appointed
y
by the UN.
demás
So the
regiones,
FAO
es un
will be
tema
the
que se ha venido
implementing
dialogando y
agency,
ya
not only
instalando en la agenda
regionally, but
global
given this
común
commitment to the
de relación a
International
los dos
Year of
ámbitos
co-ops
internacionales.
globally,
Y en ello,
since
entonces, el
from the
tema de
general
cuidado va a
direction
ser
of
central.
ACI and
Hoy,
other
gracias
regions, is a topic that
nuevamente,
we've
Damaris,
been
por haber
talking
afirmado
about
algo
and
que
already
viene por primera
discussing,
vez hasta el momento
installing
únicamente
it or
desde Cumbre
incorporated it
Américas,
in the
de
global
que
common
la Corte
agenda.
Interamericana de Derechos Humanos ha declarado el
The
cuidado
topic of
un
care
derecho
will be
humano
central. I
de las
like that.
personas,
Thank you,
pero
Damaris, for
gracias a
affirming
este logro, no
something
solamente
that only
el
from the region
31
of the
o nuestro
Americans and the
protocolo,
International Court of Human Rights
sino
have
que
declared
tenga que ver también
care
con lo
as a
que es
human rights
el
for
trabajo, la
people.
alimentación y
Thank you, because
evidentemente
it's
la
not
vivienda,
just a
como
topic
ya
of care,
lo
but
pudiste
healthcare as
mencionar, con lo
well,
cual tener
alongside
acceso a
housing, food.
un
As you
cuidado, pero tener
mentioned,
acceso a
having
trabajo digno
access to
significa
care,
también desde un punto de vista de derechos
work,
humanos,
and
significa
dignified
también
livelihood and
derecho
living, it's
a la vivienda
also
digna. Y por
viewed from the
supuesto,
standpoint
esos
of
son ejemplos
human
que vamos a
rights.
traer
The
en nuestro
right for
último
a
evento allá en
dignified
Panamá.
housing are the examples that we will bring
Emilio,
to our last event
con
in
las
Panama.
informaciones que nos
Emilio,
brinda,
the
puso el
information
acento
that
sobre
you
la
offered
dimensión evidentemente
put the
legal,
emphasis on the
pero sobre
legal
todo enfatizó el tema de
dimensions,
la gobernanza,
especially
esta gobernanza
governance.
multiactores
These
que nos lleva
multi-stakeholder
hasta determinadas
governance
conclusiones
that
a un
brings
desafío desde
us to
precisamente
conclusions
desde
and
la ASI
challenges from the co-ops
en
of
las
the
Américas
America
seguramente que es
Foundation. In the
cómo
America
innovamos, cuál
region,
herramienta tenemos para innovar, pero sobre
the
todo
question
cómo
of
nos pensamos
how to
respecto un
innovate
poco
and
en
what
ese
tools
sector
can we
y
use
respecto
to
a brindar soluciones
innovate
innovadoras
brought
frente a
us
los
an
retos
idea for
corrientes
that
en
sector
varias
offering
latitudes de
innovative
nuestra región,
solutions
en varios
facing
países,
current times in
donde
different
hay
latitudes
algunas
in our
categorías
regions
más
for
vulnerables
several
de
countries
personas
where some
eh, y hasta ahí
individual vulnerable
me quedo
categories
porque
weigh
esto es lo que
more
traeré en la
than
conclusión
others.
en el último momento. Así como Alice, que también destacó
Just like
nuevamente, pero de
Alicia,
manera
who
diferente respecto
also
a la paz,
highlighted in
respecto
a
a las
different
alianzas
manner, but
diferentes,
highlighted
el tema
the different
de
partnerships
brindar
or
nuevas soluciones y
alliances,
buscar
the new
nuevos ejemplos
solutions,
de cómo vivir la vivienda y el
searching
derecho
for
al
new
cuidado con
ways
un
of
énfasis
living
que no
housing
solamente
and the right of care,
tradicional, sino que
emphasizing
puede
not
abarcar
only in
inclusive el
traditional
problema de los
ways, but
estudiantes
also
y nuevamente
incorporating
Italia con su
students.
cooperativa Ferrara brinda desde ese
Italia
punto de
with
vista soluciones
Ferrara Co-op
interesantes
offered a
que conozco
very
directamente porque
interesting
tengo un hijo que
point of
estudia allá en
view and
Ferrara
interesting
de
solutions that I
vivienda
directly
compartida
know
entre
about.
jóvenes
I already have a
adolescentes en la próxima
child, a
universidad
son that
y adultos
studies in
mayores
Ferrara,
que de esa forma tienen, además que
shared
un ingreso,
youth
todo un sistema de cuidado
housing
o
for
de
those
vías de calidad de vida
students that are enrolled in
más elevada,
university,
superior
as
respecto
well
a
as
quienes
the
no lo
other
tienen.
side in
Y
the
con ello llego
elderly who
a Beatriz y
need
Luis,
to have
felicitaciones porque
income to
realmente
have
fue muy
access to
emocionante
a quality of life
escucharlo
and care
y ustedes
systems
tienen un tacto, una
superior with
delicadez de
respect
cómo
that
han
the
puesto sus
already
temas, sus temas
available. Finally, Beatriz
de
and
una
Luis,
dimensión de
congratulations.
la
It was
vida que
so,
tiene el derecho de
so
ser vivida de manera
emotional to
digna,
hear you, your
activa.
No,
tact and
tranquilo, continúa, pues.
how
Hay un rato
tactful
complicado.
and I'm sorry, can you
Annalisa, puedes cerrar el
cue
micrófono,
the
gracias. De una vida
gracias.
activa, de una vida digna
The right
y de
to an
varios
active,
niveles de
dignified
atenciones.
life
Y
in different levels
hemos
of
cerrado
care.
en Paraguay nuestro tercer
Closing
evento
with
hace poco
Paraguay, the
y el
third
Ministro de
event,
Educación hizo
the
énfasis en algo
Ministry
que
of
yo quiero destacar en el
Education
tema de la salud
emphasized
mental.
something that we
Es un tema que
truly
evidentemente hay
touched
que
on
tomar
mental
mucha
health.
atención, que afecta a los jóvenes,
Uh,
pero también a los adultos mayores
disabilities that affect not only the youth, but also the elderly, is something that we truly need to focus on. It's a co-care dimension, not only in practical, but in philosophical terms, and has to do with the physical and emotional exercise. Healthcare funds that were mentioned are very interesting from another perspective in Cuba COP financial solutions, incubating mixed models that can search for solutions to today's and tomorrow's challenges. CEPAL reminded us that 10 years from now, Latin America and Caribbean's population older than 65 years of age will double the amount of the current population. So we need around 30 million. That will entail a lot of jobs for caregivers, new and formalized. Formal labor is the topic to take into account because it affects all of us. Concluding new solutions, innovative solutions alongside the already existing tools to approach these topics and to convey and address them needs to be used with governance, with financial mechanisms, unusual, innovative regarding the traditional ways of managing our business are necessary. Our company, our enterprise is co-ops. So alliances within co-ops are central. We have the autonomous Trento province for co-op in Italy that already can be used in South American countries of our Latin American continent. Since they privilege those countries where Trentines migrated into. So we have an exchange tool with Brazil, Argentina, Uruguay, and Chile. Co-op housing and community systems, as they're called, can be innovator to look for those exchanges, studying the legislation, and thinking about including new ones. These are topics that we need to be aware in reality. I have two concerns to share with you, final concerns. In Panama, on 24th to 25th, it's the last event devoted to co-op and care economy and the society of care. We will be closing the regional agenda for the international year, launching the next 5 or 10 years for alliances alongside the regional committee of the compacts and new allies. The first, and I like that all of you are here, is regarding finance. We have the idea that this is a financial tool that is so necessary in the Americas to finance this type of projects, innovative projects that comprise and address topics like housing and care. The pioneers, like, for example, Martinez in Uruguay and Bea Cruz and Alfredo in Colombia, is a topic that we need to keep in mind. Second, my second strongest concern is education. I would like to thank Alicia Manero, president of the Housing Committee of the Co-op of the Americas, who told me a couple of years ago that the Panama event should solve the housing solutions facing the region, migrants. Migrants is the strongest topic regarding housing solutions and how to address them, because we've seen that temporary migrants that come to Costa Rica with a project that Carlos has coordinated, providing healthcare services, educational services for immigrant children, housing for immigrants, cooperatives, movements can offer care systems for migrants in transit. Even while they're in transit, they can have access to housing, to a system, to a foundation, developing dignified work, and insert themselves in the community and in the working market under dignified life and working conditions. I think that this is a topic that calls to our
la
reflection
posibilidad de
and
tener
to
una red,
a
la
quest
red de la
for
Alianza Cooperativa Internacional
appropriate
para extender
solutions.
esta
I think
región.
that
Tenemos
alliances
como
are
prioridad
crucial.
la posibilidad
We
de
have the
hacer desde esta
possibility of
organización como Cooperative
establishing
Europe
the
esta alianza con
International
el tema del
Co-op
cuidado
Alliance to learn
prioritariamente, pero
from
no
other
solamente.
regions with
Así
priorities
que con
and to
estas
do it with
creo que hemos cumplido,
coverage
Carlos,
in
con lo que era la
Europe.
novedad, sí,
I don't
o,
know
o
if
los
we
anuncios a
lost
ser
him.
hecho. De caso contrario, te pido
I don't know if we have
hacerlo
his
tú
audio.
directamente, pero con eso creo que estaríamos. Agradecemos también a los consejeros que nos acompañan en esta actividad, los colegas, los colaboradores, para que realmente todo el sistema de Alianza Cooperativa Internacional para las Américas se pueda encontrar en este último evento del 24-27 de Panamá dedicado al cuidado y ahí avanzar para los siguientes 5 años de agenda conjunta. Muchas gracias.
Muchas gracias, Danilo, por tus palabras. Y sí, has cubierto el importante anuncio. En el chat les compartí el enlace que tenemos desde Cooperativas de las Américas para nuestro cuarto y último evento del año internacional de las cooperativas, que va a ser en la Ciudad del Saber en Panamá, del 24 al 27 de noviembre, donde el tema central va a ser justamente la economía y la sociedad del cuidado.
November
Entonces, ese es
24 and
el importante
27,
anuncio. En el
the
chat
last
pueden ingresar
international event of the
al
co-ops
sitio
that
web del
will
evento,
take
donde
place
podrán
in
encontrar toda
Panama.
la información. Esperamos
Now,
poder encontrarnos todos y
we
todas
hope
en este
that we
evento en
can
Panamá el
find all the
próximo mes.
information so that we can meet
Asimismo,
all together
junto
in this event in
con
Panama
Annalisa,
next month.
queremos
Just
agradecerles a
like
todos y
with
todas que nos
Annalisa,
han
alongside with
acompañado
Annalisa, we would
en
like to
estos
thank
dos
all of you that have
webinars que hemos
accompanied
tenido
us.
en
The
cuanto a lo que
event
es la economía
will
del
take
cuidado.
place on
Esperamos
the
que
economy and the
sea la
society of
primera
care.
de muchas actividades que vamos a tener
In
de
these
manera
two
conjunta
webinars that
a
we've
pasos
had,
agigantados.
the economy of care will be
Muchas gracias a
one
todos y
of the
todas por
many activities
acompañarnos.
that we will have jointly between both offices. Again, thank you very much to all of you for your kind attention, and we'll see you in a further
Muchas gracias. Nos vemos en
event.
Panamá.
Thank you so much. Have a nice day, you all.
Gracias.
Gracias.
Muchas gracias.
Muchas gracias. Buenos días.
Muchas gracias. Hasta la próxima.
Buenos días.
Hi, JV. Nice to see you. Thanks
Yeah,
for
great to see
joining.
you, JB.
Thank you. See you.
Thank
It
you
was
for
it was
joining
really
us.
nice. Have
Take
a
care
nice
now.
day to everyone. Bye.
You too. How do we stop the recording?